Good morning, San Francisco and world. I'm over here and I'm going to be talking about the profession of music therapy. So, profession of music therapy as a career option. So when people think of music and stable income, the first thing that comes to mind is definitely music educator, right? Selling what you've learned to a school, right? Being a school teacher, being a part of a music organization, right? A studio, giving lessons, or having your own kind of lessons that and students that you take on. But music therapy is actually another more stable, I should say, career option, right? That musicians actually have. So music therapists can work in all sorts of different settings. We can work in hospitals, we can work in schools, we can work at home, we can work in a studio, in private practice. So music therapists can really work all over. And even between those 4 different settings, right, we can also work with as young as infants to as old as hospice care. We have a funny saying in the music therapy world, we work from womb to tomb and everything in between, and it is absolutely true, right? So music therapy can look like a lot of different things, as you might imagine, right? If I'm singing to a little infant, right, it's gonna be a little bit more like lullabies. If we're doing hospice care, we're gonna do their favorite songs, maybe a legacy project, right? We also have assisted living facilities with memory issues, so again, kind of their favorite songs and some active cognitive engagement, right? We also work with kids with autism. So kids with autism could be working on communication, social behaviors, emotional regulation, right? We're also working in inpatient rehab, rehabilitating our arms and legs, right? Woo! Using music actually to assist with the co-treat of physical therapy or occupational therapy, even speech, rehabilitating voice, especially for patients with aphasia. That is a whole nother topic of conversation. We also work in mental health facilities, right? In psychiatric care. In psychiatric care, this is actually where I work mostly right now. We're working a lot with emotional regulation, expression, healthy expression, right? Communication of wants and needs. And I like to do this a lot with songwriting. But case in point, right? There's a lot of different ways that music therapy can be used. So what is the education for a music therapist? So for a music therapist to get board certified, which means that you can actually practice and call yourself a music therapist. By the way, there's a lot of people who claim to be music therapists that aren't. So if you ever hear that someone is a music therapist, just ask them if they're credentialed, because they might not be, and they might be a music volunteer or an artist in residence, and that's not really music therapy. It's super therapeutic, don't get me wrong, but this is why. So a music therapist goes through 4 years of education to become a music therapist. So they go to an accredited university. There's about, I think, over 70 accredited music therapy universities in the United States. So that is a music degree, right? So it's a bachelor's degree, or if you have your bachelor's in music, you can get a master's degree in music therapy as well, right? So you're already dedicating at least an additional 3 years for the master's or 4 years for your full degree to music therapy, right? So you're doing music performance, you're doing music psychology, right? You're getting your clinical work, and then the specific music therapy classes as well, right? That's all embedded in the same course curriculum. So it is a good amount of classes. Just letting you know, I was taking approximately 7 to 8 classes a semester. And what they kind of do with some of these music classes is they say it's like a 1-credit class, but you're really meeting 3 hours a week for like an ensemble. And then you have other music therapy classes that are like that. They do it so they can fit your schedule. So it is a long degree. And then when you finish the degree, you're not ready yet. you still have 6 months of an internship to do. Now, music therapy internships are typically unpaid, so essentially you're learning from another music therapist. And what I would recommend is really find an internship supervisor that you like, if you're gonna go that. I mean, if you're considering the route of music therapy and you get to that point, or if you're a music therapist, student music therapist, and you're going to internship, definitely pick a internship supervisor that you like. The relationship is super important, because that's really your mentor who's showing you the field. So for me personally, I wanted to work in psychiatric care, but there was a specific person that I really saw as a mentor. So I actually changed populations for my internship and worked more with kids with autism. And it was still an incredible experience, and I got amazing guidance. Okay, anyways, tangent aside. So after the 6-month internship, you're still not done, because you have a board exam to take. So a music therapy board exam consists of 150 questions. I know, it's a lot, all multiple choice. And then they're like, oh yeah, we just want to score 120 of them. So there's 30 questions on the exam that you don't know. Sorry, 130 of them, that's right, yeah, 130. There's 20 questions, yeah, that we don't know if they're gonna be scored or not. And then you need 95 correct out of 130, so it's like something like 73%, I think, if I'm remembering right. That exam is tricky. It has a pass rate of 52%, so you know, it's not the easiest exam, but once you get that credential, you are a board-certified music therapist. And then you can finally bill for services with insurance, right? You can actually call what you do music therapy. And it is a decent road to get to be a music therapist, but it is a very rewarding field. Being able to use music in this way to help patients actualize their goals, help patients really connect with the outside areas of their life using music is super special. Right now I'm taking on mostly psychiatric work, so I'm doing groups in psychiatric care, and basically I'm doing a mix of active music making, music-assisted relaxation, and songwriting. Those are my main 3 go-tos, but I occasionally sprinkle some other stuff in there. And it's really cool to see the profound effect that music has. I've had musicians in the psychiatric unit who are separated from their instrument, and I really think that bringing in the guitar, the piano, whatever they play is very special. They're usually very grateful for that as well. If you have any questions about the field of music therapy, feel free to shoot me a comment, shoot me a DM. I'm also on Instagram as well. You can find that in the description of this video. But until then, I'll see y'all next time, and have a wonderful rest of your day. Thank you.